30 seconds. Okay.
I give it a couple of minutes. So 8, 10, just give it a couple of minutes. And if Samiji joins, we can start. I'll remind
So,
Samiji.
hey,
Let me just
Suraj,
remind Samiji. She wants to hear the start.
Bolo, Dhiren bhai.
I had a question for you.
Okay.
Why are you wearing headphones?
Oh, why wearing headphones? So because so the other disturbance would not be disturb me. I can be fully making a concentrations up here one, right? So my that's why there is no other reason.
Okay. Because yesterday when I was doing my talk, I couldn't hear very well. And a lot of people told me if you use headphones, you can hear better. So I was just wondering.
Yeah, it's just
Laptop now, okay. A cell phone and iPads are fine. But there's something about laptop speakers, they don't sound.
yeah, sometimes it is not much clear, right? हाँ तो कभी so
Yeah.
we have already live. We can
Samiji's
start
about to
if you
join.
want.
Once she joins, we can start. She wants to hear.
Okay, what do I do? Where is it?
Are you looking for a slideshow?
I found it. I found it. I'm
Okay.
just waiting for you guys to tell me when I start.
Looks good.
Okay, you can start.
All right. Can you all hear me?
Yes. Yes.
Good. So, Vandami Samniji. Okay, so
Welcome again.
thank you. So yesterday I quickly went through energy. Why do we breathe oxygen for energy? And you know how medical science, doctors, we talk about chemical energy produced by oxygen. And the ancient rishis used to talk about prana energy. And they had lived very similar functions. And then I talked about the lungs. Now, one of the things which this diagram doesn't show is that there are nerve called vagus nerve, which goes through the lungs. It starts from the brain, goes through the lungs, heart, stomach, everywhere. Now, modern research is finding this vagus nerve is the nerve that helps you relax. When you do meditation, deep breathing, deep exhalation, alternate breathing, any kinds of different types of pranayam, a lot of them help breathing, just like Kayasak does, which has nothing to do with breathing. And that relaxation happens because of the stimulation of the nerve which goes through these lungs. And very recent research is showing that not only does the brain work on the heart, the lungs, and stomach through the nerve, but activation of the nerve seems to work on the brain. It might have, uh, it might help with the memory problems. It stimulating vagus nerve will make sure that your memory is better than usual, and you don't lose the memory and all those things. So it was just interesting thing I read while I was doing my medical research. So anyway, this is the numbers I gave you yesterday. You take in 6 liters of air, 1.2 liters of oxygen every minute in the lungs, and out of 1.2 liters, 250 cc's goes into the blood, and 200 cc's goes from the blood into the lungs. The brain is a chemist. It measures these two numbers all the time, continuously. If the amount of carbon dioxide goes up because you're not breathing well or whatever, or oxygen goes down, then it will send messages to the diaphragm and the chest wall to take in deeper breaths. And so it does two things. It measures the amount of oxygen, carbon dioxide, and acid in the blood, and controls our muscular breathing accordingly also. So now we're going to talk about 3 diseases. First one is COPD. What is COPD? COPD is a chronic meaning is a long term. It's not for a short time, it's lifelong. Obstructive means the airway breathing is obstructed. Pulmonary meaning lungs, and disease is a progressive lung disease that obstructs the airflow. And there are many different diseases all grouped together, taken in COPD. The 2 commonest ones are emphysema and chronic bronchitis. And there are many causes of these 2 chronic obstructive lung diseases. One, and most of them are long-term exposure to irritants. Very few patients develop chronic obstructive disease because they have genetic factors. Everything these days is linked to some sort of DNA or genetic factors. As the research goes on, we'll find more and more things that are caused by DNA or some funky enzyme created because of the abnormal DNAs and all that. But they are less than 1%. More than 90% of the lung diseases are caused by human beings themselves. It's all our fault. And smoking is the worst culprit for lungs. It does almost everything, starting from cancers to destroying the lungs. The balloon, we talked about balloon lung and the airway lung. It destroys the airway, makes them very weak, and makes them constricted or shorter, or the radius or diameter is lesser because of these irritants. And the narrow channels make it difficult for the lungs to breathe air out. Usually, breathing in is not a problem, breathing out is always a problem. And there are many occupations that do that. When I was in London, when we studied this, 40, 50 years ago, there were a lot of coal mines in London. And those coal miners would inhale coal dust and all that. And many people got chronic bronchitis from it. And a lot of buildings were built with asbestosis. And when you breathe in asbestosis, again, it seems to destroy lungs. Now, all these are very slow processes. When you first breathe in coal, asbestosis, or start smoking, nothing happens. It takes 2, 3, 5, 10, 15 years before you develop serious lung disease, before a patient goes to the doctor, says, I have a problem with breathing. And that is a problem because by that time, after 5, 10, 15 years, most of the damage has started and you cannot reverse it or stop it. You might be able to slow it down by running away from the irritants, But after 10 years, it slowly progresses and makes things worse and worse and worse. So the symptoms you get are shortness of breath. Again, as I said, shortness of breath basically means that your normal tidal volume of 500 cc's doesn't deliver enough oxygen to the blood. And the brain realizes that there is not enough oxygen in the blood, so it will tell the muscles to breathe faster and deeper. And that is what patients will complain about. They will call that I'm resting and doing nothing, and still I'm breathing very fast and I'm taking deeper breaths than most people do. And what's the problem? That is what they call that is what they mean by shortness of breath. And what it really means is that your lungs are destroyed by some bad habits you had for maybe 10, 15 years. The other major symptom is chronic cough. They all seem to produce a lot of mucus, and mucus fills the airways. And airways are already constricted, and on top of that, there's some swelling of the inside of the airways, and mucus will start plugging those airways. And the body has developed a reflex called cough. Coughing is actually supposed to help. What it's supposed to do is clean up that mucus. The lungs don't want the mucus because it's obstructing. It's coming in the way. It is irritating the lungs. So the coughing is just forceful breathing out of air, and that will push the mucus out as sputum and cleans up the lungs. So cough is actually a treatment, but these poor patients cough so much that it becomes a nuisance. They get tired of coughing and they can't handle it. And it also becomes a social problem when you are with other people at a party or somewhere and you keep coughing. People don't like it, you don't like it, you don't feel good. So it's really bad disease. And the another important symptom is wheezing. So what is wheezing and tight chest? Uh, Wheezing is like a flute or bansuri. When you blow air through a flute at high speed and air is flowing out, you'll start making musical sounds. Wheezing is the same thing. The airway becomes so narrow that to breathe out all that air that you took in, you have to really force the air out of those narrow airways. By forcing out the air at high velocity, you create noises, whistling sounds inside the airways. If a patient is wheezing a lot, you can actually hear them. And in a milder form, you can't hear that whistling sound, which we call wheezing. But if a doctor was to put a stethoscope on the chest, he can hear those whistling sounds. So that's how, by all these symptoms and examination, doctors decide, okay, you got COPD, and we have to start treating you. There really, as I said, there's really no cure because you already destroyed a large amount of lungs and the airways by your 10, 15 years of smoking or exposure to coal or asbestosis or something. But you can reduce some of those symptoms. First thing you have to do is run away from these irritants by trying and find an atmosphere where there is no pollution in the air. If you're living in Delhi, you find some quieter, nicer, cleaner air somewhere because those pollution is gonna bug you like anything. If you can change your habit, you should stop smoking. And by the time they come and see doctors, they're coughing so much that they almost don't have enough time to smoke. So it is easy for them to stop smoking. They don't have much choice. The narrow airway means sometimes those narrowness is fixed, but some of it can be changed. You can relax those muscles of the airways a little bit. So bronchodilators are drugs, chemicals, usually taken by inhaler. And I'm going to talk more about it when I talk about asthma. And they can help a little bit. They don't help much for COPD because most of the disease is fixed, but they can help a little bit. And if none of these things work, then you have to start oxygen therapy. By the time you start oxygen therapy, it's really bad news because doctors are basically telling you there's very little we can do about it. And now and again, you see patients walking with oxygen cylinders, with a nasal airway with it, and struggling to walk. They just don't have enough oxygen in the blood to create enough energy to function normally. They're always weak and tired and exhausted. It's almost by like saying their prana energy is so weak they cannot function normally. And finally, we come to pulmonary rehab. Pulmonary rehab. I talked about it a little bit yesterday that patients are taught how to breathe out by closing their lips, half closing their lips, or obstructed breathing. Because what that does is that increases the airway pressure behind the obstruction, so the airways are pushed outwards and opened up by that increased pressure. And again, Samniji's talk about all these breathing pranayams, and a lot of them are obstructive pranayams. They deliberately teach obstructive pranayams. The purpose is really spiritual. They want you to connect with the brain, mind and soul and all those things. But at the level of the body, these pranayams, obstructive pranayams, can help a patient with COPD breathe air out easier by increasing the pressure of the airways and that's thereby opening up the airways. And so pranayams will only help this patient who are smoking if they start at early age and learn and develop techniques for a few years. And when they start getting diseases, then they can use those methods quickly, more efficiently, and all that. So that's the treatment of COPD. And again, the prevention, treatment, they all go together. Everything is same. You avoid smoking, use protective gear. We all know about using protective gears thanks to COVID, wearing masks and all those things. And I think a lot of people in Delhi have started to use masks, not for COVID, but just because the air is so polluted. And you definitely don't want to get any lung diseases. Your lungs are almost half dead anyway. So you really don't want to get flus and pneumonias. I'm going to talk about pneumonia next. But pneumonia makes things difficult for healthy lungs, healthy patients. And if you go COPD, that's really very bad for you. It's very difficult for you to take care of COPD and pneumonia together. Most of the patients end up in hospital, some end up on ventilators, and we hope that within a week or so, the pneumonia is treated and they can get off the ventilators. So that's the COPD, bad disease. I think there's less and less of it these days because people are becoming wise about smoking and environmentalists are making sure that irritants, exposure to the irritants is reduced. Like it's illegal to have asbestos in homes anymore. And coal miners are wearing protective gear so they don't get the disease as much. But still, some people still get it. So this is pneumonia. Pneumonia is a disease you don't want to get if you have COPD, but you don't even want to get normally either. We all get influenza and pneumonia frequently from mild viruses, but some pneumonias are very severe, such as the COVID. And if you had any underlying lung disease like asthma or COPD, then you're already restricted by having to take deep breaths in and out very fast, creating very high pressure to breathe out. And that high pressure is also a problem, as we saw yesterday. And pneumonia makes all those things worse because you need to breathe more to treat pneumonia. What pneumonia works on the balloon part of the pump, airway. So the lungs have the airway, the balloon, and the muscles. The balloon is where pneumonia infection happens. There's infection and inflammation of that area. And those balloons or air sacs or alveoli get filled with fluids, pus from the bacteria or virus. And a lot of cells inside the airways are broken up and they make up part of they fill up the gases also. And as I said, they all caused by some bacteria, some virus, or some fungus. So if you fill the edge of the balloon with all this stuff, then it becomes difficult for oxygen to flow out into the blood. Somehow carbon dioxide finds a way to go from the blood to the lungs, but oxygen finds it difficult. And as I said, brain is a chemist. He sees that not enough oxygen is going in the blood, and then he'll ask the chest wall and diaphragm to breathe faster and deeper. And so this is what happens. This is patient with pneumonia will come to a doctor complaining of fever. Fever because there is infection from the bacteria and viruses. And severe fevers, you can see patients shaking in chills, chilly fevers. And as I said, the brain will ask the lungs, the muscles to breathe faster because there is not enough oxygen getting into the blood. So rate at which your breathing will go fast, and patients become agitated because of that. The other thing it does is through the vagus nerve, the brain will also send a message to the heart, said you need to pump blood through the lungs faster so you can transport more oxygen to all the cells of the body. The muscles that are going to use oxygen to create energy needs more oxygen. Lungs are trying their best, and you can help by pumping the blood faster, and so the heart rate goes up. The heart rate also goes up because of fever. Whenever your temperature goes up, automatically the heart rate will go up on its own. So normal heart rate is 70. Many of the patients with pneumonia will normally have a heart rate of 100, and that also makes them a little uncomfortable. Now, because enough oxygen is not reaching the muscles and cells, the muscles cannot produce enough chemical energy to live happily and healthily. And because there is lack of chemical energy, patients feel tired, fatigued, exhausted, listless. They don't want to do anything, just sit and relax. And so shortness of breath, as I said, all the symptoms are virtually same as the COPD. Shortness of breath is because brain wants you to breathe faster and deeper to transport more oxygen. Again, you produce a lot of sputum because you want to get rid of all this pus, bacteria, fluid you collecting. It has to be pushed out. And the sputum will slowly start moving up the airways. There are little fibers called cilia in the trachea and the airways. And these little hair follicles or fibers, they keep moving upwards all the time. And any sputum in the airway will be slowly pushed up by them. Coughing will push the sputum out once it comes higher up in the airway, but the smaller airways will keep pushing all the junk by things called cilia. They are just little hair follicle type things inside the airways. And one difference between pneumonia and COPD is that sometimes patients develop pain because the balloon is inflamed and there are nerves around the balloon. You can actually, when you take a deep breath, you can actually feel sharp pain. And the more you cough and deeper you breathe, the pain gets worse. This is very severe pneumonia when this happens. 99% of pneumonias don't go through this, but there are some pneumonias where you can get pleuritic pain. And treatment is mostly antibiotics. We don't have to go deeply through it. Doctors have to do something to help you pneumonia. And by the time you get pleuritic pain, they will give you painkillers for the chest wall pain and antibiotics. And the antibiotics will help cure pneumonia faster. And while the antibiotics and the body is working on the pneumonia, the doctors also provide some sort of supportive care, which will buy time for the body and antibiotics to work and heal the lungs. Again, if oxygen level, the brain is measuring oxygen all the time. And when doctors measure oxygen, if it goes less than 90, then they start giving you more oxygen. These patients, when they breathe a lot, when you take deep breath continuously, quickly, you also lose a lot of water with oxygen and carbon dioxide, So you're breathing out carbon dioxide, but with deep breaths, you also start losing a lot of water. Breathing out also is a way in which body excretes or loses water. So many of these patients are dry and dehydrated, and the blood pressure will start falling down. So they will need IV fluids to get them back to normal hydration. And antipyretics, Tylenol and ibuprofens are given to treat the fever because patients don't like the fever and the fever is causing heart rate to go up. And on the other hand, the reason why body's temperature goes up is a defense mechanism. Body needs the high temperature to fight the bad organisms, to fight the bacteria. If you want to fight the bacteria, you can win your fight with higher temperature quicker than you do with a normal body temperature. So it's body's mechanism to fight all the bugs. And because you don't have enough energy, so the best thing to do, doctors will suggest rest. Take a rest for a couple of days until you start feeling better and then start moving around. So these are just supportive care. It's just buying time for body and antibiotics to start working. And again, just like the last one, bronchodilators, if there's any wheezing, you can use bronchodilators. Chest physio, if there's too much sputum, chest physio will help get rid of the sputum. And you got to stop smoking, of course. Bad. Finally, we come to asthma. Asthma is both a chronic condition and an acute condition. What is chronic? Chronic means it's a lifelong condition or long-term condition. And acute means although you have a mild form of asthma, sometimes it becomes really severe. And there are reasons why it becomes severe. So it's both long-term and for a short time, a couple of days or a week or so, it can become very severe also. It's acute, then it's called acute and severe both. So asthma, it has got inflammation. It's caused by inflammation. These airways get narrowed. This is normal airways and they get narrowed. I'll show you in a picture in a minute. And just like COPD, they produce a lot of mucus. So this is the airways looking inside by cutting it. This is a normal airway with muscles. This is asthmatic airway where these muscles are getting bigger and thicker, so the airways are getting narrowed. In the COPD, although I don't know the picture, these muscles sometimes become very weak, half the size. And this also becomes narrow, but this also becomes very weak. And when you get this acute attack for a week or so, then again, this area becomes even tinier. And the breathing becomes extremely difficult. You have to push. Breathing out is not so much a big problem because, as I said, explained it to you yesterday. When you breathe out, you're creating negative pressure in the lungs. Outside the balloon lung, you create a stronger negative pressure by expanding the lungs and pushing the diaphragm down. When you creating negative pressure, the pressure outside here will pull these airways outwards and open up the airway. And so breathing in is always usually very easy, but breathing out, this pressure will work on this mic, make this even worse. And then you have to breathe out at a high speed, forcefully, and that's when you can hear that wheezing or whistling sounds. And the symptoms are again very similar to what we've gone through. There's always mild wheeze in asthmatic. Most of us can't hear it, but doctors can easily hear it with a stethoscope. When they get acute attack, the wheezing or the whistling is very obvious. And sometimes when you're sitting next to the patient, you can hear them whistle out. Coughing is again the same cause. You got mucus buildup and you cough out. Coughing again is a protective reflex. What you want to do is get rid of the mucus because mucus plugs are blocking your breathing out and breathing in. And so body has developed a coughing reflex to push all the mucus out. Because the areas are very narrowed, sometimes breathing out becomes very difficult, and that's when you feel that tightness in the chest. What you're really feeling is the high pressure the muscles are really creating to try and push the air out. And if they can't, the pressure goes more and more higher, and you start feeling tightness in your chest. And it's all recognized by that vagus nerve I started with the talk. And the shortness of breath I already described is the same shortness of breath as other symptoms. Now, the asthma attack can either start in children or it can start at older age, either childhood or adult. Children who have very mild asthma, after about age 10, 12, when their lungs get bigger and expanded, they start growing out of it. They start feeling better. It's never probably completely gone. Now and again, they get an attack with severe allergens or something. But half the patients will see significant improvement and they'll feel my asthma is totally cured. Other 50% will carry on with some sort of asthmatic attacks. And some patients who never had asthma when they were young, suddenly at age 30 or 40, either because of chemicals or some external environment or something, they start getting attacks of asthma. And symptoms are very same. What triggers asthma? Asthmas are triggered. You got normal asthmatic patient, and when they come across any of these 8 things, then they get in trouble. The biggest cause is pollen and dust mite. Dust mite is in most of our beds. If you check all our beds, you can find dust mites in most places. And pollen is all the grass and everything else. And most of the asthmatic patients are inherently allergic to a lot of things: food, plants, pollen, dust mite. And when they get exposed to either pollen or a lot of dust mite, then they start wheezing a little bit more. asthmatic should never smoke. I mean, smoking is bad for everybody, but for asthmatic, it is terrible. Exercise is cold air and exercise will trigger asthmatic attack also in the patient who are susceptible to asthma. And so when they feel that tightness in the chest or mild wheezing, they should be resting and not running around all over the place. And they should keep away from cold air as far as possible because cold air itself can trigger an attack of asthma. Mold is just a fungus that will create asthma. Try and avoid infections, pneumonias, and all those things. Again, it's your tough luck. As I said, there are some foods that can cause wheezing. It's again an allergic reaction. And there are some medications you treat some disease with one medicine, and it will attack the lungs and create asthmatic attack. All the medications are poisons of some sort. It will help somewhere and make things worse somewhere else. So again, non-medical treatment, how do we support these patients? You find the triggers, all the allergens mostly. Dust mite, you clean the bed sheets every day, keep away from the pollen. Pets, the fur of the pets is also a strong allergen. Asthmatic patients will already know what pets they should stay away from, and when they see usually cats, they run away from them very fast. So just like a COPD patient, you really don't want to have influenza attack also. You're already struggling with life. So you should absolutely have annual flu shots. Breathing techniques. We already talked about pursely breathing with COPD. Same technique works for asthma. And you really don't want to get too fat because if you get fat, this poor diaphragm finds it very difficult to breathe in. It's pushing air out by pushing it downwards. And if your stomach is too big, it has to push the big, heavy stomach outwards also. So when you don't have a patient with asthma, when they don't have an attack of asthma, they should be going in the gym and staying fit by simple exercises. And this is where yoga also comes in. Yoga can teach you all kinds of asanas, posture exercises or Tai Chi exercises, and they increase your vital capacity. They make your lungs healthier, stronger, and your breathing becomes much more efficient. And so if you ever were to get attacks of asthma, you can handle it easier. The other thing which is not written here is that the other thing that triggers asthmatic attacks is stress, anxiety. Anxiety and stress is found to be a very important trigger of asthmatic patients. And again, relaxation, the best technique for relaxing to avoiding stress and anxiety, I think, is meditation pranayam. Doctors have some medications which can relax you, but they are very dangerous medications because they all sedate you also. These patients are working hard, breathing hard. The last thing you want to do is sedate them with drugs that reduce anxiety. It's much better to learn pranayam, kayasarg, all the relaxed meditation, mindfulness, awareness. If you are mindfulness of breathing, if you are aware of breathing, if you're focusing watching your breath in and out, your anxiety will obviously go down because now your focus is not on your anxious topic, your focus is on your breathing. So this is where both asanas and pranayams and meditation can help. And because asthmatic patients have chronic asthma, which is very mild, and acute asthma, which is very severe, during the good times when they don't have attacks of asthma, they should be learning all this meditation and pranayams and asanas to develop ways and means. And there are recent researches I haven't really gone through the papers, but I've read about it, which show that meditation and pranayam will help patients with asthma. So a patient who does and learn all these things and practices for a year or so, it has to be a long time. They say they will actually admit that the number of attacks they get of asthma are lesser, and when they get attacked, they are milder. This is all new research coming up slowly. So this is where meditation and pranayam and yoga will help. Of course, when you really unwell and cannot breathe at all, then you have to start using your inhalers. You might have to go and see a doctor. When there is not enough oxygen in the blood makes our color pink. When there is less oxygen, the blood will become blue, and so our nails and lips will become blue. When the doctors see these blue colors, they know it's serious, so they'll start giving oxygen and various treatments for asthma. So the aim of the treatments is to relax the airways, and for that, we have medications, the inhalers you see right at the bottom. They are all bronchodilators. There are two types of inhalers. One act on the smooth muscles and relax it. The others are steroids. What the steroids do is that if there's any swelling in the airway, it will reduce the swelling and open up the airways. And it will also reduce inflammation of mucus and prevent symptoms. Resting is always helpful when you have an attack because you're not breathing enough. Exercise is bad for you. Stress is bad for you. And although we say you reduce the stress by rest, during the rest, you should also be trying to do some sort of mental meditation also, if possible, if you've learned it, because that will help also. It will reduce the stress and reduce all the effort required to worry about breathing. Breathing, when you can't breathe enough, patients start panicking. Am I going to die? What's going to happen to me? It's like stress will cause difficult breathing, and difficult breathing will start creating central panic attacks. Goes all in negative cycle. And we can break that cycle by, doctors use psychotherapy. We just tell them, relax. If you relax, everything will be fine. Don't worry, we'll give you oxygen, treat you. But I think, again, pranayams and meditation, if you learned it, would help reduce the stress. So these are the things that improve asthma or acute asthma or chronic asthma. Avoid allergens, avoid smoking, avoid pollution, use masks when there's a lot of pollution. And if a doctor advises you to take inhalers, especially steroids regularly, then that means you really have severe asthma, then you should be taking those medications regularly, and you want to try and prevent those severe acute attacks. And again, healthy lifestyle is extremely important. As I say, when you don't have an attack of asthma, but you are predisposed to asthma, you should be going to the gyms, do some exercise, weightlifting, and take flu shots, avoid infections. And again, I said, do Tai Chi, do asanas, and increase vital capacity and make your lungs stronger. And genetics, nothing much you can do about genetics. You just have to accept it. And the only good thing is a lot of patients with asthma after time, will outgrow it and get better and better. And so what is improvement in asthma? You get few symptoms. You wake up less at night. Many patients wake up at night because they cannot breathe very well. Breathing difficulty and all that wakes them up all the time. When you have to use inhaler all the time, that means your asthma is bad. But if you can start when you reduce the need for the rescue inhaler, then things are looking good. And as I said, some young children, as they get older, they use inhalers less and less. And eventually they find they only need to use it like once a year or once every 2 years. So they're basically cured. And it is possible that at least half the children will completely outgrow asthma. They will not have any symptoms at all. But they have to remember that although they feel better, they don't have the attack of asthma, they are still very, very sensitive to the usual triggers, a strong allergic pollution or something, or cold or severe exercise will still provoke an attack. So mild asthma will get better with time, especially in kids, but many patients have to live with it. And that's that. Thank you very much. Any questions you have, I'm most welcome. If I can answer, I'll try. And that was fun. Actually, Samiji, thank you somebody asked me to do this talk. Thank you very much because I recall a lot of things I knew and I had forgotten. And now can actually, it was entertaining and interesting. And the most important part for me was how prana, tai chi, and our chemical energy all do the similar things. They're all linked and connected. That's why sometimes yogis will call oxygen prana and all that. So anyway, it was very interesting, very good, interesting exercise for me.
Thank you, Dr. Dhirendra. You are so experienced doctor. So what we can say about your presentation, the whole presentation was full of experience and real life, studies. You have already seen so many patients and you know the problem in a better way. So it is our good luck that you are in this particular course. We are getting very good doctors from the Mehta families. All doctors are so experienced, so well versed in their practices, and they are giving so excellent presentation so that everything's are becoming quite clear to us that where is the problem, what are the symptoms, how we can treat, and how yoga can play crucial role in improving all these different problems and issues. So this is a really very experiencing talk. So we are lucky enough to have such experienced doctors in our course, and we would like to listen to you all the times. It was excellent presentation which you have given.
Thank you, Samiji.
And it is true that just a breathing exercise can help us to come out of asthma problem and this airways blockages, to clear the airways blockages and the problem of breathing out in the state of asthma problem. So yes, breathe, Kapalbhati pranayam, Bhastrika pranayam, and Anulom Vilom pranayam especially, they are very, very helpful for clearing these all different issues and problems of our health. And long and deep breathing is very, very important to get more and more oxygen so that our body should have enough energy to function in a proper way. So you have rightly indicated about it. So this is what we are teaching through yoga, but our purpose is the higher purpose. We are not just getting energy for making body healthy or functional, but we also need a lot of energy to go into deeper level of our own consciousness or to explore the higher consciousness. So for that, we need more energy. That's why the yogis are focusing on the breathing.
Yes.
Okay. So that's why oxygen is the great source for energy. So our body should be completely relaxed, and what we also properly functional. We need not to have a food outside, just through oxygen. How we can survive and can go into more deeper meditation. So that's why yogis are focusing more on breathing. Their main practice is breathing for
And
going into
Suresh,
deeper
I
meditation.
also, sorry to interrupt. I also read that there are a lot of asanas. I mean, I don't know much about all the asanas. I mean, I
Yeah.
know about them, but don't know the names and all that. But then there are many asanas which will improve your vital capacity and amount of breathing you can do, the strength of the breathing and all those things, right?
Yes, it is true. So we are see Acharya Shiv Mahaprabhu used to say that everybody has to do at least a Bhujangasana, Shalbhasan, Uttan Padasana, and Surya Namaskar asana, in which there are 12 steps. So it gives massage exercise to each and every part. It activates all the different parts and take out the toxins which are accumulated in different parts, whether it is airways or any other things. Okay, so the exercise also helps us to remove the toxins or poisonous gases in the body. But yes, the breathing exercise is more important for the asthma problem, or for if our body is not properly functioning or immune system is weak. For that, breathing is very, very important. So yes, physical exercise is required, because if there are certain toxins which are accumulated inside the body, our attention would be only on our body pains, and we will not pay attention to other things. So first we have to do physical exercise, then breathing exercise, then mudras, then or walking, and then we have to meditate. First, we have to take out all the toxins and all the gases, and must have proper amount of a flow of oxygen inside the body. Then we can go into deeper practice.
And then
So
we
what
have
is
I
your-
just want to talk about
Yes.
the, sorry, go ahead.
Yes. Yeah. So that's why the whole package is that asana, pranayam, and pratyahar, dharana, dhyan, samadhi, and yam, niyam. All these 8 components together should be practiced, not just one. Okay. Yes. What you were asking?
No, sorry, I was just going to say that I think yesterday or whenever we did our in-person yoga, we did the fish pose, and I think she said the fish pose was good for opening up the chest and for asthma
Yes,
patients.
it is true. Yeah, it is true. Bhujangasana and fish pose.
Yeah,
These
any
are
of the ones that open up your chest cavity and improves the lung capacity.
correct.
So
Yes.
there are asanas that do
No,
that.
Nokasan, Bhujangasana, but Bhujangasana easy for everybody. Nokasan maybe a little bit difficult for in older age or those who have some body weight. So for them, it may be difficult a little bit. But
Right.
yes, fish
And the
asana,
Matsyasana,
yes.
fish pose.
And Ramesh is going to go over these on Thursday, based on Achash's book and the literature that Dhiren mentioned. There's the studies. So we'll review the studies tomorrow, but the ones they used, which again you're talking about, he's going to go over the benefits of them, and we'll do those again as a package on Thursday.
Mm-hmm. Correct.
Okay. So now anybody has any question with Dr. Dhirendra, so they can ask.
Okay.
It was very well explained, Dhiren. Thank you.
Thank you.
Yes.
It was really good.
And you see, the interesting thing I found, they talk about keeping you healthy and fit.
Mm-hmm.
And so yoga and Samnijis and yogis, they say Tai Chi exercise and asanas is how you stay fit and healthy. How
Mm-hmm.
it's the same thing. What medicine says and what they say is they fit in together.
So you said
Yes.
pran and chi don't goes with the atma, but oxygen doesn't go with the atma.
Yeah. I mean, it to make your lungs stronger,
Correct.
vital capacity and all those things.
Okay.
You just talk about asanas making vital capacity and things like that.
Right. But oxygen is you're relating to pran, right?
Correct.
Yeah.
Oxygen
Yes.
is the energy. Oxygen makes energy, and prana
Makes
is
the energy. Correct.
They're linked at energy level.
Right.
You need energy to function.
Right.
And prana is energy
And you need energy
Chi is
for
energy.
the Atma to go to the next birth. Is that what you're talking about, that energy?
No, at the moment, you need energy all the time, right?
No, right, I know now, but I was talking about
And a
when you
yogi
live
will
on.
say that energy is prana energy.
Right.
Or Chinese will say it's chi energy.
It's chi.
Both same thing.
Yes.
Interesting. That was good to know.
Energy is required all the times. Not
Yes,
sorry?
not for going next when we
Not
go
just for
next.
going for the next
Yeah.
birth. We need it right now.
Yeah.
No, I
But I
understand
think
that.
what you're trying to say is, of course, when somebody just talk about prana or chi energy, then they're not limited to the body at this lifetime.
That's what I meant.
It's
Yes.
also developing connection to the soul or
To the
your
soul.
identity or your different spiritual identity or something.
Right.
This is only half the story. For us, oxygen is the full story.
It was well related.
All right.
Well presentation. Dhiren.
Thank you. If you understand, that's good.
No, we really enjoyed. We really enjoyed. Means with this, the knowledge you put it up in a really simple words. So yeah, that's easily understand. Even though not from the medical field, but people can still understand, right? Yes. If I understand, they will definitely.
Yeah, both the lectures were awesome.
Yep.
Thank you.
So now, ready to meditate?
Yes,
Okay. So sit in a comfortable posture, keeping both the hands in the posture of knowledge, backbone and neck and head in the straight line, making your body relaxed without any stiffness. Close your eyes softly, and with 5 Om sounds, we would start meditation. Om. Relax your mind, body, and vocal cord. Make a resolution. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. I am practicing Praksha meditation for the purification of my psyche. The first step of meditation is Kayutsarga, relaxation with self-awareness. Concentrate your mind on the big toe of your right foot. Starting from there up to the head, top of head, see each and every part of your body, experiencing all the sensations, functions of each of the parts. give suggestion to be relaxed. In relaxation, each of the body parts from toe to head and from head to toe. The whole body is getting relaxed. Relax. Now, the second step of meditation is internal trip. Concentrate your mind at the bottom of your backbone and experience the vibrations of the center of energy, Shakti Kendra, Mooladhar Chakra. See the bright yellow color. Now enter your mind in the spinal cord and take it up to the top of the head. From bottom to top and top to bottom. Your mind should travel inside the spinal cord. When it is going up, the flow of vital energy is also towards the top of head. See the flow of energy when mind goes up and come back with empty mind to the bottom of your backbone. Again with energy, raise your mind up to the top of head. Synchronize your breath with the mind. When you are breathing in, your mind goes to the bottom And when you are breathing out with energy, the mind is going up. The third step of meditation is perception of breathing. Concentrate your mind on the tip of your nose and watch each and every breath. Each and every inhalation and exhalation. Take long and deep breath. Filling your lungs with full oxygen. You have the capacity of 6-liter oxygen. Use the full capacity of your lungs. Using the diaphragm, ribs and collarbones. Your attention is only on breathing. Connect to your mind with breathing. When breathing goes in, the mind also goes in. When breathing comes out, mind also comes out. Be completely aware of each and every inhalation and exhalation. Try to make your breath as long as possible. The last step of meditation is Jyoti Kendra. Concentrate your mind in the center of your forehead. And try to experience the vibrations of the center of enlightenment. Now visualize the full bright moon in the center of your enlightenment. See the bright white light spreading throughout your forehead, brain, in breathing, and in surrounding. It is alpha waves which are emitting from your forehead for spread and also in the brain. Experience that all your negative or aggressive emotions are getting specified or eliminated. There is everlasting peace and bliss. As soon as the emotions, negative emotions, go away, there is everlasting bliss and peace. See yourself very calm and cool, free from all kashayas, anger, ego, deceit, and greed. Now, with 2 long breaths, we will conclude our meditation session. With 2 Om sounds, conclude the meditation. Om. Uh, Now meditation is no, rub both the hands, keep on the eyes, open your eyes gently. The lectures are very good, which are going on. Anything anybody wants to share, say? Okay, so now I would like to see that everybody has to take one meditation, and at least they should give for 3 days, one person. So the wordings would be completely ingrained in your mind, and it would be more methodical. This time in exam, we were using our own language, but if we will use the proper steps and proper instructions which have been given in the text, so that will be more good for maintaining the uniformity. Is it?
Mhm.
So who will be the first to give the session? You should start with the relaxation. And it may be up to 15 minutes or more than, so that you can cover all the different instructions. So at least for 3 days continuous, if one person will give a session, then the wordings would be more ingrained in the mind.
And they can read it the first time or two, right? Just to get the hang of it, and then maybe
Yes,
stop at the end.
yes. Okay, just you can keep your text and follow the same wordings. Okay, so that I would like to see that how far it is working. And so, yeah, it would be good because we have to be completely trained in our techniques. No? So before you complete the course and get certificate, you have to be completely trained in the things. And if somebody is interested, then they can give their own presentation. For example, one presentation on what you say, on relaxation, perception of breathing, perception of body, perception of psychic centers, perception of psychic colors, contemplations on different contemplations, and perception of thought. So all these things are so that you could also have to have knowledge about the things, the text, theoretical knowledge, that why we are practicing, what is the reason, what is the scientific base, what is the philosophical base of it. So whenever you will stand to speak about anything, any technique, you would have at least the proper information in your mind. Text is already there with you, but all the times when we are speaking, we cannot see the text. It should be in our mind, it should be in our knowledge, and we should at least digest those things which are given in the textbook. That should be the part of your own experience, own consciousness. So this can also be the right way. So 3 days you have to give the practice, and 3 days, if possible, give the presentation, one presentation after 3 days. So that will help you to understand things more, but in a better way, and to express with full confidence. Clear? So anybody is interested, they can just start taking and giving the presentation too. Okay. Dr. Devendran has already given so many presentations. So he is already the expert of it, but just other people can do that. And Dr. Naina has given all the 8 techniques, a presentation on 8 techniques. So she has also picked up very well all the textual informations and what we say, explanations about the things. So other people can start giving presentation. Just one presentation, at least we have to start. Clear? So mostly we give one assignment to our students, especially when I was teaching at FIU, that they should give presentation on one of the topics which I have taught in the course. And they give very good presentations. So you all are so much matured people, no? Have a good background of everything. So I need not to say that you will not give, you will give better presentation. Okay. So thank you. Have a good night.
Thank you
So,
very much.
Samiji,
yes, yeah, let me know who is Dr. Naina was talking.
Sorry, I
Yes.
was just going to say that this Friday and Saturday we won't be having any class, so it would be maybe better to start from the following. Well, we can do 2 days. Well, we have Wednesday and Thursday. It wouldn't be a 3-day long meditation session.
Yeah, it is true. Yeah, this week, just so you can prepare yourself for 2 days. It may be that I will give the session, but if somebody is interested, then 2 days are enough right now because we have 2 days only. Friday and Saturday we are engaged in the camp, so it would be difficult to arrange a class, take the class. Okay, so yes, who is ready to give session? Just you can keep the textbook before you, but try as much as if it is far in your mind, the same thing.
I can try, Samniji.
Okay, you have already given on relaxation, so you know all the instructions. So just you have to see that you are not skipping anything.
Mhm.
Okay.
Okay, Samniji.
Okay, thank you.
Okay.
Vandami Namasami Samniji.
Yes.
Vandaji Namaskar,
Sami
Samiji.
naman, Sami, Sami.
Okay.
Samiji, thank you.
Thank you. Thank you. Thank you. Thank you. Thank you.
I had two.
Go ahead.
I had 2 quick questions. So, are we not having class this Friday and Saturday?
Correct. We have a camp, JVB camp, which I think
Okay.
all hands on deck. So somebody just too tied up. You know,
Okay.
she'll be busy. So that's kind of not the reason.
So we've
we're
actually
going to
moved the
catch up.
classes. So
Correct.
we've
We're
moved
gonna
the
catch up.
classes.
Okay.
Yeah.
Okay.
gonna-
And I had one quick question. When somebody was saying about teaching a class, so does that mean like the 30-minute lecture that we do in the first half, like one of it we would teach on any specific topic, or just one of the topics she's already taught, just teach it again?
You can summarize anything into a topic
Okay.
before you can. Let's say that you want to talk about, I'm just making it up, on sympathetic system or something. You know, you can connect the dots. I think you
Okay.
make your own presentation. Use the material, of course, anything you wish, but you can create some other perspective that might be interesting to you. That's just an example.
Okay.
But I think, and we'll create time for you. So once you've got it ready and you want to do it, we'll create time for you. It's not difficult. But I do like the idea of talking and teaching. So because we're going to do that as teachers. So that's kind of it. So you can pick a topic already and cover it again, connect different topics, or synthesize something that you might find connects with you. You can do that.
Thank you.
Okay.
Okay.
Yeah. And we won't laugh. We'll be pleasantly surprised. So it's going to be fun. It's all family here, right? So good
No,
place
you can
to
laugh.
learn.
It'll make it lighter on me too.
I know, I'm just joking, but it's a good way to expose yourself in the group that you know, right? That's one of the things
Yeah.
why you do that. So, and then we'll give you feedback, obviously. So, all right.
Okay.
So no
Thank
worries.
you.
All right.
All right.
Any help? Let me know. I was lots of ideas. So,
Definitely. Bye, everyone. Jayendra.
okay. Bye bye.
Thank you, Devendra Bhai.
All right, Jayendra.